Constipation occurs when a person has difficulty emptying the large bowel. Home remedies and lifestyle changes can often help resolve it, but sometimes, it may need medical attention. Constipation can happen for many reasons, such as when stool passes through the colon too slowly. The slower the food moves through the digestive tract, the more water the colon will absorb and the harder the feces will become. A person who poops fewer than 3 times per week may have constipation. Sometimes, constipation results from a blockage in the large intestine. In this case, a person will need urgent medical attention. At other times, it may simply be due to a lack of fiber or water. The main symptoms of constipation include difficulty passing stool, straining when passing stool, passing less stool than usual and lumpy, dry, or hard stool. Other symptoms include pain and cramping in the abdomen, feeling bloated, nausea, loss of appetite. Constipation on its own can be uncomfortable, but it typically is not life-threatening. However, it can become a problem if it is a symptom of a more serious underlying condition, such as colorectal cancer, or if it starts to cause further damage. Damage that can arise as a result of severe constipation includes rectal bleeding after straining, anal fissure, which is a small tear around the anus, symptomatic hemorrhoids, which are swollen, inflamed blood vessels in the anus, fecal impaction, which occurs when dried stool stagnates and collects in the rectum and anus, potentially leading to a mechanical obstruction. Other possible complications include a reduced quality of life and depression. Seeking medical advice for constipation may help prevent complications. Let us discuss some common causes of constipation. Lack of fiber in the diet. People with a high intake of dietary fiber are less likely to experience constipation. This is because fiber promotes regular bowel movements, especially when a person combines it with proper hydration. High-fiber foods include fruits, vegetables, whole grains, nuts, lentils, chickpeas, and other legumes. Low-fiber foods include high-fat foods, such as cheese, meat, and eggs, highly processed foods, such as white bread, fast foods, chips, and other pre-made foods. Physical inactivity. Low levels of physical activity may also lead to constipation. Some past studies have found that physically fit people, including marathon runners, are less likely to experience constipation than other people, although the exact reasons for this remain unclear. People who spend several days or weeks in bed or sitting in a chair may have a higher risk of constipation. Some medications can also increase the risk of constipation. These include opioid pain relief drugs. These include codeine, oxycodone, and hydromorphone. Tricyclic antidepressants. These include amitriptyline and imipramine. Certain anticonvulsants. Examples include phenytoin and carbamazepine. Calcium channel blockers. These lower blood pressure, and certain types lower heart rate. They include diltiazem and nifedipine. Antacids that contain aluminum. These include Amphogyl and Basalgel. Antacids that contain calcium. One example is Tums. Diuretics. These remove excess fluid from the body. Irritable bowel syndrome. People with functional intestinal difficulty, such as irritable bowel syndrome, have a higher risk of constipation than people without the condition. A person with IBS may experience abdominal pain, bloating, distension, changes in the frequency or consistency of stools. With IBS, constipation can fluctuate over time. When constipation is not present, there may instead be loose stools with diarrhea. Aging. As people age, the prevalence of constipation tends to increase. Up to 40% of older people in the community and up to 60% of those in institutions may experience constipation. The exact cause of this remains unclear. It may be that as people age, food takes longer to pass through the digestive tract. Many people also become less mobile, which may also contribute to constipation. Medical conditions, medications, and a low intake of fiber or water may be other factors that lead to constipation with age. Changes in routine. When a person travels, for example, their usual routine changes. This can affect the digestive system. Eating meals, going to bed, and using the bathroom at different times than usual could increase the risk of constipation. Overuse of laxatives. Some people worry that they do not use the bathroom often enough, and they take laxatives to try to solve this problem. Laxatives can help with bowel movements, but regular use of certain laxatives allows the body to get used to their action. This may cause a person to continue taking laxatives when they no longer need them. The person may also need higher doses to get the same effect. In other words, laxatives can be habit-forming, especially stimulant laxatives. This means that the more a person depends on laxatives, the greater their risk of constipation when they stop using them. For this reason, people should talk to a healthcare professional before they start using laxatives. This will increase the risk of fecal impaction. Not drinking enough water. Regularly drinking enough water can help reduce the risk of constipation. Other suitable fluids include naturally sweetened fruit or vegetable juices and clear soups. It is important to note that some liquids can increase the risk of dehydration and make constipation worse for some people. For example, those who are prone to constipation should limit their intake of caffeinated sodas, coffee, and alcohol. Colorectal problems. Some health conditions that affect the colon can impede and restrict the passage of stool, leading to constipation. Examples of such conditions include cancerous tumors, a hernia, scar tissue, diverticulitis, colorectal stricture, which is an abnormal narrowing of the colon or rectum, and inflammatory bowel disease. In pregnancy, around 40% of women experience constipation during pregnancy. This can result from hormonal changes, physical changes, such as when the uterus presses on the intestines, dietary or physical activity changes. Many women take iron supplements during pregnancy. These can contribute to constipation and other changes in bowel habits. Treatments for constipation will be discussed in a separate video. Thank you for watching.